I want to show how I do a dental block, or really actually it's a lip block. I used to do intraoral blocks and found that they took too long. They were also sometimes a little bit unpredictable. I'd have to go back in and try to do it again if I didn't really get a good block. So the lip blocks are a lot more predictable. They're less uncomfortable for the patient because there's a lot less of their face that's numb at that time. So I usually use a combination of lidocaine without epi, with a little bit of lidocaine with epi, only because I don't like the palpitations I get with epinephrine. And also, I think it lasts about an hour. I use 3/4 of lidocaine 2% and 1/4 lidocaine 1% with epi. And that seems to give me about the perfect amount of time. And it also, there are some people that just seem to not get a good block without the epinephrine in it. So I use about an average 3 cc's on the top. And there's a lot of different ways to do this. I just wanted to just show a demonstration of how I do mine. So what I'm going to do is I'm going to take her upper lip, kind of hold it up, and then I'm going to, this is with a 1/2 inch 30 gauge needle. I direct it just in front of the canine. And also I look for so there's usually some veins right around the same area I want to inject. And if I can see those, then I can just avoid them. And I go about, say about a 1/2 inch above the border of the lip, which it seems to be dripping. Okay. And I'll count to 3 while I jiggle, and you might feel just a little bit of a burn. And then 1, 2, 3. And then I think for me, because I'm a wimp, the secret to making these painless is just to inject very slowly. So people may feel just a little bit of a burn at the start, and then they don't feel anything except their lip starts to feel fat. And on each side in front of the canine, I'll inject about 1 cc. Okay. And then I'm going to switch over to the other side. Sometimes there's a little vein in the way. I don't see anything really obvious right in front of her canine. So the same thing, I'm going to jiggle it and count to 3. 1, 2, 3. And then just inject really slowly and put in about a cc. And the most sensitive part is usually right underneath the nose. So after I've numbed up the outer part, I go back in through the part where I can tell where that little bit epi is blanches. And then I get up underneath the nose and put a 1/2 cc in on each side. And then 1, 2, 3. And same thing, because it's so sensitive here, you just have to make sure and inject really slowly. And if you do this to yourself a time or two, I think you have a whole new respect for how slow you really have to inject. And then the jiggling is just distracting, although sometimes it probably makes the patient a little nervous if they think both hands are jiggling. And then we'll get the other side. And you can see where it's a little blanched from the epi. And then 1, 2, 3. Okay. On the bottom for my lip blocks, I usually just do a standard menthol block. And with the same type of solution, and maybe about 1.5 cc's on each side. And I jiggle it a little bit. And I aim in front of the canine. A lot of times there's a little frenulum right there. And then while I'm jiggling, I kind of keep my third and fourth fingers on the jawline there because I can kind of feel it bulging up as I inject, and I know I'm in the right place. And then I'll count to 3. And then 1, 2, 3. And then just inject a little antigrade and very slow. And then I'll get the other side. And then we're going to go just right in front of that little frenulum. 1, 2, 3. And again, just inject really slowly as you start. And antigrade it. You just head a little bit farther down at an angle towards the mental nerve. Okay. So I'm just going to go in through the vermilion border and put a little thread into the border just to accent the Cupid's bow and lift up any little tiny lines trying to start. Is it burning? Okay. And I inject antigrade and retrograde here too. And you can kind of see the light reflex off the border. And this is a 30 gauge hyaluronic acid. And just make sure it feels normal. I don't want to massage too much because I think that makes it swell more. And we want it just a little bit extra in the pink of the lip. But she has good lips to start with, and we want it subtle. So I go in through the border just to minimize bruising. And I use my finger to just project the lip forward a little bit. And then I put a thin thread in. You can kind of see where my needle is. And we're not going for big lips, so I'm just going to do one thread into it. Make sure it feels, is that okay? Mm-hmm. Okay, yeah. Make sure that it feels even. And it's basically just a little thread going down to the bottom of the mound in the bow. And then I'll come out a little bit laterally. And same thing, go through the border. Inject into the vermilion border, all the way up to my previous puncture. And come down. Push down on the lip to project it forward a little bit. And then put a thread about halfway down on the dry part of the lip, fairly deep so it doesn't look lumpy later. and then taper it down so that it's not as thick on the outside. And she doesn't really have a wide mouth at all, so we don't really have to worry about going out any farther laterally. But I'm going to just accent the V, so I'm going to go up to the top of the border and stay in the vermilion border and just Are you okay? Mm-hmm. Okay, good. We'll do the other side. Let me just go through the border. Let me know if anything burns or feels sharp. I can advance up to the top of the border, inject as I go in, inject as I come back out. And I just watch as I come back out to see, is it filling the way I want it to? And then I'm going to use my finger to project forward and turn my needle down and go down and put a thread down into the lip just underneath the top of her bow. Make sure it feels normal, that it feels even. And I'll go down and just accent the top of the bow. And she doesn't really, her philtrum columns are perfect, so she doesn't need to accent those at all. Do a little bit of a V up to the top of the bow. And then laterally go through the border. It lifts out the border nice and makes lipstick just look crisper, or it helps get rid of any lines if someone has some perioral lines. And then a thread down into the lip and then back. Just put a little bit more in here from the front. And on the bottom, really, the borders on the bottom, you can fill the vermilion border on the bottom, and some people need it, some people will have some little lines along the edges. But for people who really don't need the border, if you put the border in, you don't really notice it, so sometimes it's a waste of product. So, and most people want to have a little bit of a fullness to the middle of their lower lip. So what we're going to do is go through the vermilion border on the bottom. And same thing, I'm going to just push in to project her lip forward a little. We'll go through the border and then up, kind of to give her that little pillow. I'm always staying anterior to avoid the artery in the back. And then what I do is kind of fan. On this side, smooth it out. If she had that depression in the lower lip, that raphe in the middle, we would not try to raise it because that's a natural structure there. But she doesn't. She doesn't have that division, so we just lift this up. Then taper a little bit to the side. Hopefully the other side you don't feel at all. And I think just by doing these, they're almost like little vertical struts, rather than a thread across, I sometimes get just a better pillow effect. So I want the fill to kind of come around and taper out as it goes out towards the corners. And just put a little bit more over here.